first we start observing from the external part. Okay, so from starting from the external, like what is the body setup, what is the body condition, and then what is the feather part, all these things, that will give some clue, then start opening. Okay, so whatever this thing, this is a very adult bird, like it's a layer bird. Okay, when you start observing, just for check the body condition, whether it is well built or it is having the emaciation. Okay, so here if you see, it is a well built bird. Okay, so if you see this part, that means some rodent population in the shed. If some rodents are there, these debilitating birds, they start eating them. Okay, so this part is completely debilitated, and also the muscle setup is it's completely devastated. Okay, so this kind of debilitation happens in some chronic diseases, like if any tumor development is there inside the body. This one you have to see first. Then the feather setup. Here the feathers are smooth and shiny. So this bird is having good feather conditions. Okay, in some cases you will be seeing this kind of, not exactly this one, maybe something like this. So the feathers are not very healthy. Okay, ruffled feathers. Okay, this ruffled feathers, it may be due to managemental condition or because of some infections also. But in managemental condition, if lice problems are there or mite problems are there, then you will be having like this. See this thing? So it is having some issues with the ectoparasites. Okay, so the feathers will not be there and the skin also having some issues. Okay, so that you can observe first before you go for internal examination. So other organs when you start are this one. So the comb and beak are the important indicators. So if you see here, this is adult male comb. So comb should be this is a healthy comb. Okay, so it should be highly vascularized. We should have the dark pink in color. Because of the postmortem changes, it has become very dark. Otherwise, it will be like this color. Okay, so any comb cyanosis or populations, so those things you can observe here. In case of fox, you will be having the populations only because in the body parts where the feathers are not there, there only you will be seeing the populations. One bird is having small, this one. See this kind of. This is not exactly the population, but I just want to show this kind of very, see. So this kind of lesions you will be finding in the comb and the wattles and wherever the body parts, wherever it is not covered with the feathers. So that kind of warp, this one is indicated for fox. And sometimes what happens, swelling of the wattles will be there in case of pasteurellosis. Okay, pasteurellosis and infectious forenza. So you will see the swelling around the eyes, eyelids. Here it is very clear. But whenever there is a swelling, there will be a lot of fluid accumulation will be there in the lower eyelid region. Sometimes it may be unilateral or sometimes it will be bilateral. Okay? So those things you have to observe in the head portion. So when there is a severe cyanosis of the comb, you can suspect for Newcastle disease or bird flu also. Okay, in bird flu you have to see two portions mainly. One is the comb. So comb there will be severe cyanosis, will be the dark color, it will be bluish, and also you have to see the shanks. Okay, so there will be what happens is hemorrhages just below the skin. So what happens is this is a very clear color. So when there is a hemorrhage here, so just below the skin, so there will be bluish discoloration in here. So these two are the very good indication of, even in the flock level, if you go and see, there will be a comb and shank. These two are the very clear indicators for the bird flu cases. Okay, and this is for external examination. Sometimes you will also see the bumblefoot conditions. Suppose if the cages are not good. Okay, so here it is very clear, the top. Okay. Whenever there is a cages are not maintained properly, when there is a rusting or there. So what happens because of the continuous standing and then scratches, so there will be very big swelling will be there and then subsequently it gets infected with staphylococcus. So that condition is called bumblefoot conditions. So those cases are also very common in dark-haired pouch. Okay. So before opening, just examine the comb, beak, wattles, go for the legs like this shank region and then examine the foot, then body condition, feather part. Okay, this will give you a good idea before you go for opening. Okay, so then it is like this now. Just start cutting from the keel bone, the end of the keel bone where the junction is there, no? So the sides. Just make two slits. Then it will be very easy for you to pull apart. Okay, then you pull it, all the internal organs will come to you. They will get exposed. Then free the sides. Okay, like this. Without disturbing other organs, so that you can examine individually. And then free the joint. So this joint is there now. So that you just little bit free. So this is a free method. Okay. Then the bird can easily lie. The carcass can easily lie on its back. So now it will be very comfortable for you to examine. So first what you do is just pull this is a keel bone end. Okay, just remove the skin part over this. Observe the breast muscle portion. So this is a well-built body. So the muscle should completely fill the keel bone. This is a keel bone. Okay? It should be straight. Okay, in emaciated cases what happens, because the muscle is completely removed, it will become bent. Yeah, it will become very prominent as well as it will be disfigured also. Okay, and this will be completely empty. You can see the keel bone itself nicely here, like when there is a debilitation happens. So in those cases you have to suspect for any chronic disease. It can be mycoplasma or it can be any tumor disease. Okay, and also you examine the color of this muscle. Okay, it should be like this. Hyperemia, because of the postmortem disease, the color has become dark. Okay, freshly dead carcass, you will be less. This is young birds. So that's why the muscle color is like this way. Okay, this is too clarical. Okay. So here what we have to see is sometimes hemorrhages will be there. Streaks of hemorrhages may be there. So that it occurs in some viral infections like IBD as well. Okay, in infectious bursar disease, you will be seeing streaks of hemorrhages in the breast muscle as well as in the thigh portions also. Here, if you remove the skin and see this area, this is very clear now. So sometimes in infectious bursar disease, you will be seeing streaks of hemorrhages. Okay. And also in case of heat stress, especially during peak summers and all, you can easily find out whether the bird have died of dehydration and heat stroke. Wherein there will be patches of cooked up appearance will be there. When you cook the chicken, it turns into white color first, no? So like that, wherever it is exposed to heat, usually on the one side, where the birds are lying on one side, no? So in the cages. So one side will be completely white, like cooked up meat will be. Okay, so that gives the indication of that bird has undergone heat stroke and then it has died. Okay, so that those things you have to see: hemorrhages, color of the muscle, built up of the muscle in the breast portion. Okay, then you just open it, you can see the internal organs. So this one is the liver. Here you can see the liver lobules clearly. Okay. So the color of the liver, and many diseases affect the liver. So you carefully examine the liver lobules. Okay, the color should be like this. Okay, sometimes it becomes very pale. It becomes very pale liver, especially in chicks it is normal. But if this one. This bird, if you see, the color of the liver is so much pale. This condition is called fatty liver condition. What happens here is, like the fat, because of the excess fat, you can see the abdominal fat here. Okay. Yeah. When you open itself, you can make out, because other birds they not have it. This is actually broiler parrot. It is normal to have little bit, but this is a very heavy deposition of the fat layer. And during the metabolism, what happens? The fat goes and get deposited in the liver. So it has become very pale. And it becomes like, you can see the difference. Here the edges are very sharp. Okay. See the liver edges, very sharp and discrete. But here the edges, if you see, become rounded. Okay, it's swollen and it is rounded. And also if you feel the consistency, it is highly friable. That means if you keep the finger itself, it will break because of the high level of fat in there. Okay, this is called fatty liver condition. So this is a managemental issue, and as well as the genetic issues also there. Okay, in a heavy layer it happens, especially in the broiler parents. Okay, this is a fatty liver condition. And in some cases, what happens in toxins, in aflatoxin problem also, it becomes paler than this. It will not be yellowish, it will become very much pale, like chick liver, like this. Adult liver will be looking like this color. Okay, paler than this. So there you can suspect for toxin problems, toxins in the field. So color change in the liver is very important. Okay. So one more change is tumors, especially you might have seen the slides, like where the tumor, like tumor focus. Today we don't having the cases, but usually we get the tumor lesions over the liver. It will be like white nodules, and the liver will also looks too much big. When you open itself, it will become very big. Okay, sometimes you will get discrete nodules, sometimes it will be very big, diffused, very small, tiny nodules will be there. So that is indication for Marek's disease or avian leprosis or reticuloenteritis. These three are the major tumor diseases which affects the liver mainly. Okay, liver and internal organs also. Sometimes if you see the spleen, this is the spleen organ. Okay, okay. So it is too big. It is enlarged than the normal size. So when you have the lesion in the liver as well as spleen, you have to examine the kidneys also. So sometimes you will have the tumor lesions in almost all the organs because the transformed T lymphocytes will be there in the liver, forming the discrete foci, and then spleen also will be seeing the lesions and in the kidneys also. Okay, sometimes very rarely we will be getting in other organs. Here you see this is too big. Both are of same flock. Okay, same flock, same age. This is a normal size and this is too enlarged. So here you can suspect for some, but liver is not so big, but little enlargement is there. See, little enlargement is there. Because you can see some, it may have some tumor transformation. Okay, it's not very severe, but initial stages. In spleen, it is clear. Okay, so it may have Marek disease infection because we are vaccinating all the birds. Still, some like whatever missed birds are there, so they may be sporadic. Followed by spleen. Spleen is an immune organ, so whenever there is a viral infection, you can see the change. The outer not much changes you can find. So this is a gallbladder. Yeah. Okay. So not much.
It's normal.
It's here in this case it is normal, and not many pathognomonic lesions you will find in the gallbladder. Okay. So liver, the intestinal system, that is starting from proventriculus. Crop is just below this one, so later on you can examine. So this is the proventriculus. Okay. So in proventriculus you have to see the always see this one, okay, papillae. Okay, so this is here it is very clear. In case of ranicolitisis, you will be seeing the pinpoint hemorrhages just in the tip of this acid secreting papillae. Okay, so you will be seeing the pinpoint hemorrhages here. And this is the junction between the proventriculus and the gizzard. So just cut off on the junction also. In some viral diseases like IBD and all, you will be seeing the hemorrhages at this junction. Okay, this mucosal part, there will be hemorrhages you can find. Okay. Then examine the gizzard. So in gizzard, few things you have to see whether the bird has taken the feed or not. So that you can make out by the presence of feed in the gizzard. Okay, this is the normal. So this bird has taken the feed. So there is no chronic condition is there. Okay, and also you can observe sometimes what happens in the feed if there is any toxins. This membrane will be hyperemic, and then necrosis also sometimes will happen. This yellow membrane is called coiling membrane. Okay, coiling membrane is very clear, and if there is any toxin, there will be severe hemorrhages will be there, necrosis will be there. Okay, peeling off also will be like it might have been peeled off. Okay, if there is a toxin, too much of toxin if it is there. Then just examine just below this membrane where the gizzard membrane is okay or not. Okay, here it is very clear. Okay, some cases you will be finding the necrosis. So that they are all feed related. Whenever there is a problems in the feed, there will be necrosis, hemorrhages, all these things will be there in the gizzard. So that also gives good indication. This is the glands. Okay, that also indicates mucosynthesis only. Okay, the hexagonal structures are the papilla. So that is a structure we are able to see. Suppose in case of hyperemic cases. Okay, serous of hemorrhages, if it is diffused, then you can also suspect bird flu. In bird flu cases also there will be serosal hemorrhage. This internal side is called mucosal hemorrhage. When it is in the serosal side, okay, you can suspect those kinds. In those cases, you have to see the heart epicardial hemorrhages. Okay, in heart, in the epicardium there is some little bit of fat will be there. Okay, this is epicardial fat. In this place you have to see that is not an exclusive indication, but you can link it. And down to it you have to go for the intestines. So this is called duodenum. So the small intestine starting is duodenum. Okay, this is a duodenal loop. Okay, in between the duodenal loop, this is called pancreas. Okay, this is pancreas. So pancreatic texture of the pancreas is very important. So in Newcastle disease, it becomes necrosed. It becomes very hard. So when you touch itself, now it is smooth tissue type. But when it is becoming necrosed, it becomes very hard. To feel itself, you can see the changes. Okay, that you have to observe. Then coming to the intestines, so very common. Then it becomes duodenum, jejunum, ileum, and then followed by cecum and large intestine. Okay. Here, what you have to observe is intestines. Sometimes you will be finding the hemorrhages. Okay. Here now it is very clear. It should be like this. Okay. This is small intestine loops. So you have to see the contents. In case of enteritis, it will be like the contents will be too much watery and there will be greenish discolor. This is a normal color. Okay, so there will be in necrotic enteritis and all. When you open the intestine, there will be hemorrhages inside the intestines, and the texture also will be changed. The condition is called Turkish towel appearance. So that will be there in necrotic enteritis, in clostridial infections, E. coli infections also. So the internal consistency of the mucosal membrane, you have to check it in the small intestine. And subsequently you have to come down to the cecum. Cecum is the main indicator for coccidiosis. These two are the cecal loops. These two pouches, blind pouches are there, na? So these two loops are cecum. Okay. Then generally what happens is fermentation happens here. So that's why the contents looks very dark here. Okay. So this is the normal color of the cecal loops. Okay. Whenever there is a coccidiosis happens, when you open itself, it will be filled with blood and it will look like hemorrhagic. Okay, hemorrhagic tube kind of thing. When you cut, there will be a lot of blood will be oozing out of it. So that is for fecal coccidiosis. Okay. When sometimes intestinal coccidiosis happens, in intestines you can see the hemorrhages. Okay. In intestines you can also find out some ulcers. In mucositis also you will be finding button ulcers in the intestines. So those things you have to observe. Depending on some, if there is indication that it may have mucositis, then you start observing the proventriculus, then see the intestines for button ulcers. Like that you have to go. Okay. So this is about the cecum. Cecum contents and color you have to observe. This is the normal color and consistency of the cecum. Okay. And then just below the cecal pouches, where it joins with the intestine, there are two small swollen areas are there, no? These two. Okay, they are called cecal tonsils. Okay, they are immune organ. They are called gut associated lymphoid organs, GALT. Okay, so in any viral infections which spreads through intestinal route, there will be hemorrhages in the cecal tonsils. See, now this is normal actually. Small dots are there, no? This is normal actually. So when there is a hemorrhage, there will become too much hemorrhages. So red dots you are able to see now.
Swelling.
This is not swelling actually. Swelling generally we don't find.
When there is infection, it doesn't happen.
No, swelling doesn't happen. It becomes hemorrhagic.
Okay.
It becomes very thick and then a lot of blood will be there in this organ. Okay, now it is very clear. When small dots are there, it becomes very prominent when there is a severe hemorrhages are happening. Okay, this you have to see in the cecal tonsils. Cloaca will be there, and then in small birds you have to see for the bursa. Okay, so two birds you can see. So bursa is important organ. It is well prominent only in the young birds. 3 to 6 weeks old birds, you can see prominently. Okay. Just where the intestine ends, you just see this portion. In adult birds, they are like what you say, like they are regressed. See, this is the bursa. Now if you see, this is the bursa and the color is normal and size is also normal. This is the maximum size of the bursa for this bird. Okay, so when there is an infectious bursal disease, when you open itself, this will become like a ball kind of thing. So you can easily find it out. And there will be severe hemorrhages will be there. It becomes swollen also. Okay, when you cut open, generally it has a lotus petal kind of things. See, the petals type it is coming out.
This is normal.
This is normal. There is no hemorrhage, nothing. Okay, so in bursal disease, there will be edema, there will be severe hemorrhage, and size itself will become double or triple. Okay, that you can easily find out. This is a bursa. See, if you see this intestine, they are all shrunken. You can make it out now. They are all shrunken. So this is severe dehydration has happened, and the bird has not taken any feed. That's why the intestines are not filled up. See, it's all very shrunken and there is no contents. Okay, the bird has not taken the feed, and then so this is a normal, like this is 4 or 5 weeks old chick bird. Then in heart, see here, this is a normal heart. You have to observe the pericardial membrane. Okay, so this is the pericardial membrane. It is very clear. You can see the internal like heart muscles through the pericardial membrane. It is very clear, soft and glistening. Some cases like when there is an adenoviral infection is there. Okay, infectious IBH cases. Okay, so in IBH cases, especially a 4 serotype, so that causes Leach's disease, hydropericardium syndrome. Okay, so there will be a water fluid will be accumulating just in the pericardial membrane. So a lot of fluid will be accumulating there. So that looks like a leech. That's why the disease is called Leach's disease. Okay, that is because of adenoviral infection. In heart, you have to see the if there is any fluid accumulation, and then you have to observe the epicardial fat. This is epicardial fat. Okay, any hemorrhages are there. So in some cases like pasteurlosis and all, you will be seeing the hemorrhages there. Okay, and even in blood flow also there will be epicardial hemorrhages will be there. That you have to observe in the heart. And if you see here, this case, here you can heart it is completely blocked. So there will be a white color membrane is there. Okay, completely it is deposited over the heart. So this is called urate deposition over the heart. Okay, the uric acid is there, no, because of the excretory metabolism. So the completely urate has been deposited over the heart. Okay, blocking all other conditions and causing mortality. So this is called the urate deposit. Okay, gout, visceral gout. So there is a visceral gout. What happens is the uric acid get deposited over the heart and then followed by kidneys also. Okay, so this is a gout condition. So this is the normal heart, and this is a in gout condition how the white deposit has happened. So it's like a chalky material. Okay, and you can also observe for the same case. You just observe the kidneys. See how much it is. This is here. It is normal kidneys. Okay, normal kidneys will be like there are 3 lobules fixed in the synsacrum. Okay, in the membrane, like in the bone cavities, it will get filled up. So there will be 3 pairs of 3 lobules will be there, and then there will be ureters will be there. That comes and joins in the clavicle. Okay, this is a normal kidney consistency of the lobules. But when gout happens, the the uric acid get deposited in the kidneys. See how much big it has happened, and looks like stone. Okay, nephritis as well as urate deposition is there. So this is a male bird, so testicles, and here it is a female bird, so ovary. Okay. So in layers, you will be seeing the different levels of the developing yolks will be there. And in birds, there is only one oviduct. Only left oviduct is active. Okay, you will be finding only one oviduct. Okay. This is the oviduct which is having the egg. See, it is in the laying stage. This is the oviduct. This is internal laying, and there egg will be there in the oviduct itself. One case we saw not today. Here, you see, this is called egg bomb. Okay, this is also because of the hormonal disturbances, feeding disturbances, and handling also. If you do laying birds, if they are frequently handled, the birds will be fearing to go for oviposition. So in those cases also it will happen. So that is called egg bomb condition. Okay. So in non-layers, it will not have the developing yolks. It will be like small red rust. Okay. Then there will be lungs. You have to examine just below the thing. You can see the lungs. So in this case, it is damaged. See here also it is a gout case. Yeah, gout case. There is one more condition is there where it is called CCRD. That means E. coli with the CRD, chronic respiratory disease combined with E. coli infection. In that also, what happens is white membrane will be there. That is called perihepatitis. Now the liver is very clear. No, what happens in CCRD? White membrane kind of thing. This one and that one you have to be able to differentiate. Here it looks like a chalk. When you sprinkle the chalk over the heart, it looks like this. Okay, there will be uniform membrane will be. Okay, that get deposited over the liver. Okay, that is called perihepatitis. And over the heart also. That is called pericarditis. Okay, here this case is gout. Okay, both the condition looks a little similar in the initial stages. Once you start observing, then you can differentiate it. So this is the heart. Here this case also gout is there. And see the lungs. Lung colors should be like this. Should be, yeah, pale pink. Generally it doesn't expand like other animals. It gets fixed in the bony part. Only the air exchange happens through the air sacs. Okay? So here it is very clear. This is the normal lung, this one. In any respiratory problems, the respiratory infections, lung becomes very congested. Severe congestion, so there will be reddish, it becomes very reddish and thickened. Okay? So this is a normal lung consistency. Okay. And in birds, there are 3 pairs of air sacs. Okay, one is clavicle air sacs, there will be thoracic air sacs and abdominal air sacs. So there will be 6 will be there. So when you open it, that they become torn off. Okay. So generally it will be like this size. So in air sacs, what you have to observe is, in case of CRD, in case of mycoplasmal infection, there will be severe, like it becomes yellow, like, see this is a yolk now, like egg yolk now. So you will feel like egg yolk kind of thing accumulated in the air sac. Okay, that is a lot of pus. Pus material accumulating in the air sacs because of the mycoplasma infection. So that's a very common condition we will observe. Today we don't have that case, otherwise we generally find that kind of case. So when you open this one, you have to see the air sacs in this side. When you see, this is the abdominal side. It is not torn out now. When you pull it, it will become, you will get damage. So this one, abdominal air sacs. This is normal. Should be like this, transparent. Whenever there is infection is there, the yellow cheesy material will be there in the air sacs. That occurs in the mycoplasma infection. Okay. So this case here in this particular bird, it is a particular condition. Okay, here in this bird, it is gout condition. Okay. Then coming to the other organs, so you have seen the heart and you have seen the intestinal part and all, so reproductive organs also. In reproductive organs, so in case of infectious bronchitis, okay, so infectious bronchitis, coronavirus infection of birds, we will be finding 3 variants. One is the respiratory form of the disease, wherein only lung and trachea is getting affected. The other form, there will be oviducts are getting affected. So the oviduct, what I was showing now, what happens sometimes is it will be completely filled with fluid. Lot of fluid accumulation will be there in the oviduct. When the young birds now affected, so that becomes atrophied. The oviduct becomes atrophied. When they grow, they will not lay. Okay, so the water fluid accumulation will be there. So that is infectious bronchitis. So that you have to observe in the reproductive organs. And in some cases, when they do the AE now, so because of the improper AE and frequent disturbances, there will be damage to the oviduct, and subsequently it gets infected. That time what happens, it becomes enlarged with the pus material. Okay, there will be very big tube with a lot of pus material. That is called salpingitis. Okay, these 2 conditions you have to see. And in ovary, this is a normal ovary. Sometimes whenever there is infection like salmonella infection or pasteurella infection is there, this becomes very like pedungulated, like the ovaries they will be saying. It means it will become very long, the stalk will become very long. Okay, and it will be like more hyperemic. Here it is congestion is because of the postmortem changes. Okay, there it is because of infection, there will be changes will be there. So those conditions you have to observe in the reproductive organ. Sometimes what happens is egg will be laid inside only, and that subsequently causes peritonitis because of the hormonal disturbance and other disturbances. And
This
what
one
happens?
written inside only.
Yeah, internal laying. It is called internal laying. Okay, that is because of so many causes are there for that. You have to see the kidneys also. So kidneys, as I said, there is a chance of nephritis. Okay, so in gout condition there will be a lot of urine deposits will be there. So here it is very clear. Okay, so the kidney lobules are there, and then ureter. The thin membrane is there, no white thread kind of thing. That is ureter. This one, very thin line.
Yes.
Okay? It's like a thread, both the sides. That is the ureter. That directly comes and attaches with the cloaca. Okay. This is the normal color of the kidneys. And sometimes in case of infectious bronchitis, there is nephropathogenic form is there, where it affects the kidneys. So there also you will be finding like young broilers, you will be finding the severe nephritis. Okay, so the kidneys will get congested and then there will be mottling, all these things you will be observing in the kidneys. But you have to observe. Okay, then after examining all the internal organs, you try to check the bones also. Okay, here when you see this is a sciatic membrane. Okay, in Marek's disease, in the older form, like when there is a neural form is there, that was very common in earlier cases. So this is a sciatic membrane. So unilateral enlargement of the sciatic membrane is very characteristic of that form. Whenever the one bird, they'll pull one leg front and one leg backward. So that is a typical of Marek's disease, neural form of the Marek's disease. In those cases, you have to examine this is the sciatic nerve. Okay, this is the normal size. This is around 6 to 8 weeks bird. This is the normal size of the sciatic membrane, sciatic nerve. So it should be like this, thickness as well as shining. So both the sides you have to see. Unilateral, it becomes 2 to 3 times bigger than this. Okay. Now both the sides are same and normal. Okay, so it's a normal sciatic nerve. So that is characteristic only in the neural form of Marek's disease. Okay, then you start examining the femur head also. So So this is a femur head. This is normal. Okay, in some cases like reoviral infections, you will be finding the necrosis of the femur head. The femur head completely get necrotized. Okay. In Clostridium infection also sometimes it affects the bone and then the femur head becomes necrosed. Okay. Then examine the bone marrow. See, this is the normal bone marrow color. Okay, so there is no changes or no infections there. In case of chicken infectious anemia, so this bone marrow is completely replaced with a fibrous tissue. So it will be very much pale. Completely only fibrous tissue will be there in this. So in those carcasses, if you see itself, the entire carcass will be pale, will not have any blood. And if you examine the bone marrow, it will be completely having fibrous tissue only. So that you have to examine. Now we have examined, so we have examined the bones also. Then coming to the top part, wherein the respiratory, upper respiratory tract, how to examine. This is the beak. Just open the beak, check the tongue and other lesions in the mouth. So sometimes what happens in pox, there are two forms. One is dry form, another one is wet form. So dry form, we will be seeing the pox lesions only in the combs and arteries. But in wet form, what happens? Only the dichrotic membrane will be formed in the beak. So when you open, you can see the membrane. Okay? And also see the ulceration of the tongue or any changes. And some fungal infections, you will be seeing the fungal spread in the mouth also. After examining, just cut open the beak, then open. This is the trachea. This opening is there, no? So this is the trachea. In respiratory disease like ILT, infectious laryngeal tracheitis, wherein the upper respiratory tract is severely affected. So in live flock, if you see, there will be like a severe bleeding from the mouth will be there. And also in the feathers, no? So because it shakes the head, so the blood clot will be there in the body surface also. So from that you can have a clue that this birds may have the ILT infection. And when it comes to the postmortem, you have to cut open the trachea. So here you will be seeing clear blood clot. If you open this, now it is normal. Okay. In ILT, there will be completely, it will be filled with blood clot. So because of that suffocation, birds die in ILT. So only upper respiratory tract will get affected then. In other respiratory infections like Newcastle disease and bird flu and all, you will be seeing slight hemorrhage in the tracheal membrane. Okay. That you have to observe. This is about trachea and upper respiratory tract. And also you have to observe just below the skin the muscle hemorrhages. So many viral diseases will be seeing the pedicle and the streaks of hemorrhages in the thigh muscles and just below the skin. That also you will be observing. And in the vent portion, what you have to observe is, especially for the backyard poultry, there is a vent pecking is a very common condition. Okay, so the birds start pecking the vent region, and then when the blood comes, all the birds will get attracted towards them and start pecking. So because of that, the intestines and all, it will get pulled out. Okay, that condition is very common. So for that, you have to go for DPT. Because they don't perform the DPT, they start pecking region. So there you can see the vent region, it will be completely, it will get all wound injuries will be there in this one. And also sometimes prolapse will be there. Okay, because of feeding issues, there will be intestinal prolapse. And in heavy layers, there will be uterine prolapse also will be there in some cases. Okay. And in some examination, we also open the brain portion. Just cut open this head and then just open the skull portion. You can see the brain. Brain mainly we observe two cases. One is heat stress. During heat stress, there will be hemorrhages in the brain. And in avian encephalomyelitis or encephalomalacia, those conditions, it will be completely like pale and then there will be degenerative changes will be observed. So in normal, this one we don't observe. In those suspected cases, we go for observation of the brain.